I'm all about having patients make an informed decision and understanding the risks, the long-term risks of getting implants, including breast implant illness, and doing our job as plastic surgeons, like is required by the FDA, to talk about breast implant illness, so that, in my opinion, patients, if they do develop symptoms months, years down the road, they know at least to get treated, to see a plastic surgeon, to potentially get their device out. What really is unfair to the patients is when they're walking around with breast implants, they're sick, they've got breast implant illness, and they're being gaslit and dismissed and, put into other categories of chronic inflammatory conditions and being treated with, medications and other therapies. And really all they need is to get their implants out.
I feel like when folks come in now, and I still get I went and saw my plastic surgeon and they said breast implant illness was actually not
Real.
a thing. Right. And I was like, well, that's not exactly true. When I was in, the plastic surgery organizations, I was the co-chair of the task force for the FDA meetings on breast implants. And then I gave testimony. And then when I became president of the Research Foundation, one of those societies, I said we would provide, resources to do studies. Patients have to be like, hey, I feel this way, and be very clear on the history. And then the providers, like, you should, as a provider, if you're listening to this, you need to be aware of any device, IUDs, neurologic devices, Norplant, any
adjuvant, to what you said earlier about Asia, right?
Everything can cause a problem.
Right.
So you better be doing, if you have a patient with chronic inflammatory symptoms, a very, very strong inventory of what surgeries people forget they've even had surgery.